So good afternoon, everyone. You've had a long day, and am I the last presenter of the day? So I'm between you and the exits or the prizes, or okay. So I'll try to move it along. Thanks very much for having me. The Executive Director of the Massachusetts Health Council. The Mass Health Council is a 97-year-old health and wellness and preventative care organization. It was started shortly after World War I. The legend is that the soldiers were returning from World War I, and there was a tuberculosis epidemic in Massachusetts, and so a bunch of physicians and nurses and Red Cross workers and public health officials got together and started the Mass Health Council to educate the public about tuberculosis, start treatment facilities, things like that. So it continued in this sort of loose affiliation for all those years, and took on all of the really big public health issues that you think of when you think of public health campaigns. So going back to the 20s, there was an issue around having iodine in salt, because if you don't get enough iodine in your diet, it leads to all sorts of health problems. And so the Mass Health Council advocated that salt makers, they were already doing this out in the Midwest, but advocated that they start adding iodine to salt in the Massachusetts salt supply. Similarly, fluoride in the water, another big public health campaign that the Health Council took on. So this meshes really nicely with my career, in fact, because I'm a lawyer by background. I worked in the state legislature, and I work mostly around big payment reform issues. That is, you probably all know, right, that our healthcare system is based on kind of a fee-for-service structure. You go see a doctor, they order a test, they do an exam, they charge a fee for each of those particular things. It's believed that fee-for-service system incentivizes overspending in medical care and in fact causes overtreatment. People get too much medical care in some cases because the whole system is set up that you get reimbursed when you do something and not when you take what's sometimes the more appropriate path of sort of watchful waiting in medicine. A lot of the focus for the last 10 years in health policy circles that I've been around is in moving away from that kind of fee-for-service system towards payment systems like global payments or bundled payments and things like that. The idea is that if you pay providers a lump sum of money or in some format where they don't just get paid only when they do something, they get paid to keep people healthy, that will actually inure to the benefit of the whole healthcare system and to the patients themselves. So it will help keep healthcare costs down. So it turns out the Mass Health Council has been this organization that's been around for 97 years, advocating out there every day, advocating to do things out in the health sector and not just be about medicine. Actually keep people healthy, keep them from needing to go to the doctor, needing to go to the hospital. So that's a little background about B and how this all intersects. I'm here to talk about what is a culture of health. So let's start with a couple of definitions. The first one, and I'll read it just so we're all on the same page. So the Mass Health Council's mission, a culture of health, prioritizes healthy lifestyles, wellness, and preventative care so that people and the communities they live in can thrive, the cost of medical care is reduced, and the burden of illness, disease, and disability is lessened for everyone. So that's part of our mission statement. We cribbed that, honestly, for a little bit from Robert Wood Johnson Foundation, which is actually the next definition that I threw up here just to give you another sense of it. And I won't read the whole thing, but here it talks about a culture of health broadly defined as one in which good health and well-being flourish across geographic, demographic, and social sectors. The Robert Johnson definition is much more embracing of the sense of equity, the fact that there are parts of our Commonwealth and our country where people do lead pretty healthy lives. They have access to healthy water, good food, a clean environment, parks and recreation, things like that, and there are places where they don't. And then the last part of the Robert Wood Johnson definition talks about choices. That a lot of times when we talk about these things, really what we're just trying to do is give people the ability to make the healthier choice. And I'll talk a little bit more about that later. So let's see if this thing's going to cooperate with me. Oh, good. But we have to take a big, giant step back because we're talking about a culture of health. We all know what the culture part means. What do we mean by health? So let me ask you a question. Who knows who Jon Snow is? See a couple hands. That's good. This Jon Snow? Not this Jon Snow. This is not the Jon Snow. This is Jon Snow from Game of Thrones. And I had to look online and I find pictures of Jon Snow, and there's not a single photo of him online where he doesn't have these deep, brooding eyes like that. And he's wearing a bear, apparently. But this is the Jon Snow that I want to talk about. So this is Jon Snow he was born in 1813. He is what's often considered the father of epidemiology, the study of the pathways of disease. Because here's this really cool thing that he did. So it was London in the 1850s, and there was this terrible cholera outbreak. And John Snow was investigating what was causing this problem. And he actually started mapping where incidents of cholera were occurring around the city. And he took out a big map and he put little dots wherever the cholera was occurring. And he discovered that there was this one water pump, right? Back then they didn't have water in their homes. You had to go out and find a water pump and pump the water and bring it back home. And there were clusters of cholera around this one water pump. And he thought, well, maybe the water's causing it. Because at the time, the current thinking in medical science was that disease was caused by what they called a miasma. It was disease in the air. It was hot, and they didn't really understand the germ theory. They just thought that these conditions somehow generally led people to get diseases like cholera. But he's found that there's this cluster around this one pump station, and then he noticed there was another cluster. It was further away from that pump station, and it was near another pump station. And he thought, well, that doesn't make sense. If it were this pump station causing it, then those people over here wouldn't be sick as well. So he went and interviewed those people, and this was another good example of how public health progressed. We actually got out of the hospital or out of the office setting and went out and talked to people about where they live and what they do. And he found out that the people even in this other section were using that other water pump because they thought the water tasted better. It turned out, of course, it was contaminated with all sorts of terrible things which were causing cholera. So he's considered the father of epidemiology, which leads us to this distinction between health and wellness. Between medicine and health, right? Because medicine and health are very different things, but that doesn't necessarily naturally occur to us. And so this slide just sort of in your face represents the fact that medicine is the things that happen in a hospital, the things that happen in a doctor's office. Health is what happens outside of that. And it's honestly what all of you do, right? It's what you're doing in your own workplaces. It's what we at the Health Council try to do in our context, where we're trying to create healthier living conditions for everyone. So let's get some specific examples. Always good to have a graph in a presentation like this. When you start to think about how you can improve conditions to make people's lives better, here's a really easy example, and I have another one around fires. So I'll tell another story. There was a terrible fire, the Coconut Grove fire in Boston, in the 40s, I believe it was. 425 people died. It led to a kind of revolution in fire safety. They realized that you needed doors to open out, you needed clear signs of egress, you needed lighting, all sorts of things. It took a while for all that and all that was adopted on commercial level. What you see on the graph is actually about home fires. But you can see that as we adopted better rules and a culture around fire safety, rates of fires started to plummet and deaths from fires started to plummet. It's really just about changing that culture. And here's a really interesting point about all this. If you think about what firefighters did in their daily job, right? They get a call, there's a fire, they go put the fire out, they go back to the station or they go back home. Firefighters actually started becoming fire safety professionals. They didn't just stay in their fire station and put out fires when they happened. Instead, what they would do is go out and proactively inspect buildings for fire safety codes. They would get involved in legislation around fire safety so that you could create an environment where fires are less likely to happen. That's what we want to do. That's when we talk about changing a culture. You really talk about changing the conditions that people are around. Firefighters did it around fire safety, and it worked enormously well. The medical community is beginning to get to the point where it can do the same thing. And I personally think, and we see a lot of examples of this, that they will start to partner with folks like yourselves to work with you directly. And in a perfect world, we would actually have a system where people who are doing outside health and wellness are actually reimbursed as medical providers in a way. They're sort of part of the system. Worksite wellness, YMCAs, Boys and Girls Clubs, senior centers, organizations like that keep people healthy in the first place would be considered part of our healthcare system. Not our medical care system, but part of our healthcare system. So another graph to illustrate this, how easy, easy is not the right word, but how impactful it can be when you sort of start to change hearts and minds on things. Smoking peaked in the 50s, right, or 60s, and then we started public education campaigns around smoking, simply informing people that smoking is bad for you, that it will end your life. So there was a broadcast ad ban. There was, and then that leads to a chunk of the population that hears that message and changes their behavior. It's really hard. Tobacco is addictive, so changing behavior with tobacco is uniquely difficult. Whereas other nutrition items, it might be a little easier. Other activities, it might be a little easier. And the next thing along the line they did was they doubled taxes on cigarettes. That gets you another chunk of the population who responds to that message because it hits them in the pocketbook. And then it just continues that line down. But it all starts around this education so that you can educate people about this. And to pause on that for a second, I mean, if you think about what's, the last 10 years we've been having this running national debate about our healthcare system, to Obamacare or not to Obamacare, and all of that. And all that's really just caught up in medicine. Really, that's all just caught up in what kind of health insurance you're going to have in case you get sick. But we're trying to pivot towards much more a culture of health, where people can, where the money can actually be put out into the community so that people can lead healthier lives. So what can we do? So let me talk a little bit about what we do with the Mass Health Council to do this. The big thing we're working on right now is an education campaign around sugary drinks. Right? The evidence is really pretty overwhelming that sugary drinks, whether it's Coke or Mountain Dew or vitamin water or iced tea, sweet iced teas, those sugary drinks are uniquely bad for us. And so, again, this is a matter of educating people about knowing this. Probably most people that you know are aware that drinking a Coke a day is, or 2 Cokes a day or something like that is not good for them. But you'd be surprised at how many people don't drink a vitamin water that still has 20 grams of sugar in it, not realizing that 20 grams of sugar is about as much sugar as you should get in a full day. And these things just, they work their way into our diet. We're inundated with advertising from the people who make them, and someone needs to counteract that. And so the Mass Health Council is leading a campaign around that. And that campaign actually has 3 parts, as most good sort of population health, public health campaigns do. The first is an educational component with kids. So we're going into the schools and talking to kids. I actually just came, but it was just this afternoon, our sort of pilot kickoff was in the Brennan Middle School in Attleboro, just up the road. So convenient for me to get back here. We had a speaker who got up, we had someone from the Patriots who got up and talked to the kids, an ex-Patriots player, I should say, who talked to the kids about the importance of drinking water. We had a slide presentation by some folks from the YMCA's that concluded with a Family Feud style, game show that the kids got really into, where you sort of educated them a little bit about what sugars in what kind of drinks, and then ran through this fun game show. We have a poster contest. We'll have follow-up things like this. So I love to think about this all the time, that if you guys are actually talking to folks in their workplace, and we're talking to folks, to kids in the schools, we're actually getting both halves of our lifespan. We can start educating people about healthy lifestyles and wellness when they're young in the schools, and we can continue that on in the workplace. So I hope we can share information about that. And also the other important project that we have is around connecting people to their local wellness committee. So it turns out that every school district in the country, but here in Massachusetts specifically, is required to have a school wellness committee, a group of people, parents, teachers, administrators, just local folks who are interested, who design a wellness policy for their school. And we've been talking about this in terms of whole child, whole school, whole community. Right? These are little nuggets of grassroots activism, people who can get excited about making their community a healthier place to live. It could all start in the schools, but it doesn't have to end in the schools. You can actually kind of keep that whole thing going. So I would encourage all of you, as folks who know and understand health and wellness, seek out go knock on the door of your superintendent in town and ask them if they have a wellness committee. Sometimes their answer is going to be, I have no idea, because it's just not something they paid attention to. But in either case, join these things and lend your expertise to it. Because really what they do is they meet on a regular basis like any other sort of official body, official committee, and they come up with a document of some kind. They're supposed to issue every 3 years a wellness policy. The deadline for the last one was all due in June. So they're going to be starting their process again for the next iteration of this 3-year wellness policy. And lastly, we are very involved in the opioid crisis, which has been a terrible thing here in Massachusetts, a terrible thing around the country. We issued a report several years ago that talked about the opioid crisis and sort of highlighted the fact that we were seeing these massive increase in opioid deaths and overdoses in certain parts of Worcester County and down on the Cape. And that was one of the first things about 5 years ago that awoken us to the fact that we had this crisis going on. So we stay continually involved in that. So I wanted to come here and talk to you about a culture of health and what you can do in your workplace. And I realized you know so much more about what you can do in your own workplaces. The last presentation talked a lot about incentives and programs and things you can do in your workplace. For me, I would talk about, try to hide the sugary drinks. Try to get sugary drinks, away from your employees to the extent that you can. Simply banning them in the office seems a little overkill, but you can, in some ways, make them less available to people. That's always helpful. from the perspective of public health professionals, it's really about education. It's a stage process. We first give people the information to make the right choice. Then we try to make the right choice a little bit harder, whether in some cases that might be, if you think about tobacco, the education phase was putting warning labels on tobacco packets so that people knew when they picked this thing up that it was going to have a very harmful effect for them. Then you went to the next stage of actually putting taxes on tobacco, so it was much more expensive to buy cigarettes. And then the last stage in this, signed into law in 2004 by then Governor Mitt Romney, was a ban on smoking in workplaces. So very few places left that you can actually go and smoke it if it's a work environment. That's the stage process that we bring people through. So that's my presentation. I guess I would love to have more of a conversation with folks about things that you do in your own workplace that you find work in terms of education. Does anyone have ideas of their own or policies or programs that they work on that in terms of educating people in the workplace? Thought I saw a hand and I thought it went down. Is that right? Oh, here we go. Yes, please. Oh, that's great. So she was saying that it's a 30-day healthy eating challenge. And do you start off with sort of education component to that? Do you tell them what you mean by healthy eating?
Yes, we go over healthy eating.
Great. So a culture of health, to try to answer the question very specifically, is around creating an environment where people can lead the healthiest life that they can. There's a saying in sort of public health and population health circles that your zip code is more important than your genetic code. We all are going to have problems based on our genetic background that we inherited from our parents, whether it's a tendency towards obesity or diabetes or hypertension or mental illness or anything like that. But the zip code, where you live, has so much to do with how healthy you're going to be because it enables the choices that you can make. And we're really trying to create that same environment in the workplace. Give people the tools that they need to make the right choices and then try to nudge them a little bit in the right direction. That's what a culture of health is. All right. Thanks very much.